My name is Ashley White, and in this presentation, I will be reviewing the Innovative Health Information Technology Program, NurseGrid. NurseGrid can be used by staff nurses, charge nurses, nursing supervisors, unit directors, and administrators. NurseGrid improves and eases communication amongst team members, facilitates scheduling, and improves department productivity. NurseGrid is a free mobile application that can be downloaded to individuals' cellular devices and computer tablets. Information regarding NurseGrid can be obtained from www.nursegrid.com. The app can be downloaded from the Apple iStore, Google Play, and other application download centers. NurseGrid facilitates communication among all team members in one centralized location. Shift availability and open shifts can be rapidly assessed. Nurses can make shift changes amongst themselves and immediately communicate their change with their manager. Nurse leaders can also choose to manage their staff's credentials and contact information via NurseGrid. Adequate staffing levels have been proven to be directly correlated with job satisfaction. Both staff and leaders must be flexible in their schedules to accommodate the needs of the department. A key to successful scheduling in the emergency department is aligning staff to patient volume. Inadequate staffing can affect the flow of patients through the department and ultimately the throughput of the entire hospital. NurseGrid can be used by both nursing staff and leaders. Currently, our staff scheduling is done using paper and pencil. Each nurse must write their vacation requests on a calendar, and approval is communicated in the same manner. NurseGrid allows for immediate communication to the manager regarding scheduling requests and direct feedback to the nurse. Staff is able to place their availability, the hours they are currently working, and invite or ask coworkers to work on understaffed days. Both staff and managers can input data into NurseGrid. The left picture is an example of a staff nurse's profile. The nurse can report when they are available, request vacation, enter their credentials, and find technical support in this area. The left picture is an example of a staff nurse's acceptance or decline for a request by the manager to work a specific shift. On the left, the manager has an individualized dashboard that details who is working on a particular day and future staffing needs. On the right, when a scheduling request is put into NurseGrid, nurses can elect to have push notifications sent directly to their cell phone. The systems development life cycles are ways to implement information systems effectively and efficiently. Because NurseGrid is a mobile application and website, implementation in the department is relatively simple. The waterfall model is most appropriate for this project. During each phase, the output flows into the next and becomes the input for the next section. The informatics nurse specialist and nurse leader will collaborate to assist any team members in the downloading of the application or use of the program. The emergency department is unpredictable, posing difficulties in proper staffing to ensure both patient and nurse safety. Patient volume changes rapidly and is variable hour by hour. Safe nurse-patient ratios improve patient outcomes, including mortality rates and patient satisfaction. Appropriate staffing improves patient wait times and decreases the number of patients left without being seen. Nurses also make less medication errors and are able to meet national standards such as aspirin administration for acute myocardial infarction patients. Specifically, younger generations report higher job satisfaction when their scheduling needs are met. Turnover rates increase when nurse-to-patient ratios are high and staffing shortages exist. Self-scheduling improves both job satisfaction and turnover rates. NurseGrid allows for self-scheduling and independent balancing. Thank you for your time.